Anishinaabe police are investigating a tragic incident in Casablanca Lake First Nation. A 19-year-old man has died after an all-terrain vehicle rolled over on Friday evening. The victim was brought to the community's nursing station. Despite life-saving efforts, he couldn't be saved. NAPS officials say they believe it was a single vehicle collision. The circumstances of the crash are still under investigation.
A provincial watchdog is shining light on the hospital staffing crisis in the Rainy River area.
The Ontario Health Coalition held a news conference today, hoping to convince officials in Toronto to respond to the dire situation. All of the small town's doctors have announced that they'll leave the hospital in just 2 weeks. Lee Noonan has the latest details.
There are 3 doctors staffing both the hospital and the clinic in Rainy River, but not for long. They will all be leaving the hospital at the end of the month. In the meantime, the ambulance base in nearby Emo has been slated for an indefinite closure.
It's just a terrible, terrible thing that's happened, and there needs to be some significant changes in order because otherwise people are going to die. It's that dire.
The Ontario Health Coalition organized a virtual news conference to draw attention to the crisis. Executive Director Natalie Mera says she's afraid it still won't be enough to grab the headlines and the attention of those in power.
I feel kind of sick about it, frankly, Randy. I don't think we do enough to raise these issues, but because there should be a spotlight on what's happening in Northern Ontario. It is terrible. It's unprecedented. It's terrible. It absolutely puts people's lives at risk.
The Emo EMS base is actually one of few in the Rainy River District that's fully staffed, but it's being closed in order to relocate the staff and keep other bases open.
We're no longer treading water and we're starting to drown.
Malcolm Daly, local union president representing healthcare workers in the district, says the overtime paramedics are putting in is astronomical, but that the closure leaves people in Emo unprotected.
Not only the town of Emo, but multiple other townships, Barwick, Chapel, 2 First Nations communities, Rainy River First Nation and the Catchaweenan First Nation, as well as multiple industrial sites, having their access to emergency pre-hospital care increased by 100%. I mean, we're talking about doubling the time that someone has access to paramedic services.
Rainy River Mayor Deb Ewald is also chair of the Rainy River District Social Services Board, which oversees the EMS service. She says the closure is a temporary measure. She's hoping they'll find more staff once word gets out that they are so badly needed.
If we lose 2 more paramedics, we can't operate. We don't have the staff to operate, period.
Ewald is also concerned about the Rainy River Clinic. 1 doctor will be staying on at the clinic until the end of November, but there's no plan after that. And hospital officials say they have found enough temporary doctors to keep the ER open until late November, but there's no long-term solutions yet there either. Lee Noonan, TBT News.